the same link provided. So let's get started. First of all, I would like to introduce Karen Goff, who's the Manager of Nutrition Connections, to let you know a bit more about us. Over to you, Karen.
Thank you very much, Lynn, and I'd like to welcome everyone and really thank you for joining us today, and we're delighted that you are as we delve into the shaping of health for children and youth today. I'm sure that many of you can appreciate it hasn't been a straight road to get here, and you all have had your unique experiences. It's definitely not been a straight line. And while not a straight line, the idea of actually getting everyone together started about 2 years ago. The idea of bringing together experts, influencers, practitioners, and knowledge users together. Last year, it also included the application for a CIHR grant, and also in support was the Elderly Foundation in a generous grant. So here we are today. So just a few things about the Nutrition Connections. Sorry, I'm just gonna go a little slower to the next slide. Okay, if many of you know who we are and that we've been around for a while, we've actually been around for just over 20 years now, and funded primarily through most of those years by the Ministry of Health in Ontario. We're really a center for nutrition services, resources, education, training, and a knowledge exchange and collaboration center. We help you, health professionals, businesses and government, community organizations, educators, and researchers, anyone working in food and nutrition, meet your needs, learning, connecting, and sharing. So we're actually operated under the Ontario Public Health Association since 1999, and formally funded, as I mentioned, by the Ministry of Health and Long-Term Care. Currently, we're supported in part by the Elderly Foundation, and we very much appreciate that. What you might have seen is known as from our previous name, Nutrition Resource Center, NRC for short. We've taken the liberty to rebrand ourselves over the last few years with a new name, new website, new services, and some new focus areas. A very large part of that has been focusing on food literacy, and we're delighted to be sort of sharing some of those resources with you that we have developed. Okay, sorry. One thing that is new for us is really we've launched some new services over the last year or so, knowledge sharing, advocacy, and policy support, and our consultation services. You can find more about these services on our website, and just watch any advertising for those services. But one thing we had mentioned is our food literacy focus. It's been a big highlight for us over the last few years, not just through webinars and podcasts and training, but also through developing reports, from evidence briefs to the State of Healthy Eating and Food Literacy in Ontario report series. If you haven't had a chance to look at those or check those out yet, they are also available on our website.
I did.
And okay, a few highlights around the applied research portion more in the last year has been the release of our Greenbelt report, an infographic on food literacy and child care programs. We also had developed an Exploring Eating Behaviors and Trends in Children. We're just working on that report right now in conjunction with research from Ipsos, and again, generously supported by the Elderly Foundation. And I mentioned earlier our CIHR planning grant, which is supporting in part today's event. Gesundheit. As many of you have already seen, we have some lofty goals for today's session. Not just assembling all of you guys across Ontario, but we're really looking to broaden and learn from what's happening across Canada and even beyond with some of our keynote speakers today. We're also really looking forward to some exchanging of current and emerging research to increase our understanding of those interventions impacting children and youth, looking to identify gaps and, on the other hand, potential opportunities to improve food literacy in children and youth, reach consensus on food literacy priority actions for research and policy and programming that we may be able to act upon, and explore ways to facilitate collaboration on next steps. And the very last point I want to say is, while it wasn't a straight road, we really are very appreciative and acknowledge the range of people who have really been supporting getting to today's event. And I won't mention everyone by name, but as you can see, there's quite a few people. And to that, I'd like to thank or acknowledge our funding support again from CIHR and the Elderly Foundation. Without you guys, this wouldn't have been possible today. Okay. I'd like to introduce Lynn, who will be taking over the next presentation as I stop sharing my screen. So sit back, enjoy, engage, and we'll look forward to talking to you on the other end.
Thank you, Karen. I'll just pull up my slides here, if I can find them. Which I can't find right now. I don't know where they are. Okay, hold on a second. Shoot. Thought I was ready, so just give me a moment to find the slides.
Lynn, while you're putting that up, one thing I didn't mention, I really want to highlight that the Nutrition Connections is a key program within OPHA, and OPHA is recognized as a charitable nonprofit organization by Revenue Canada. So we haven't historically mentioned that quite as often as we have, but I really just wanted to highlight that you know, a lot of the work that we do really supports that mission. So thanks, Lynn. Over to you.
Great. Well, I hope you can see my slides now. We just thought, in order to help frame the day, Jess Haynes and myself would share some food and eating trends in children and families, just so it would set the stage for why it's important to be discussing food literacy. So first off, not meeting recommendations for healthy eating has serious social and financial costs, amounting to $13.8 billion per year in direct healthcare and indirect costs. We know we need action to address the unhealthy eating patterns, especially in children and youth, to improve the quality of life and reduce some of these chronic diseases associated with the burden on healthcare and society. Efforts to address unhealthy eating patterns increasingly consider food literacy as an important influence on eating patterns. Before we go further, we thought we'd stop and talk about what do we mean by food literacy. And we know there's a lot of different definitions out there. We are very pleased to be part of, as a knowledge user, a part of the locally driven collaborative project, which is a project managed by a group of 8 and more public health dietitians who have been working for many, many years on defining what is food literacy, looking at what those attributes are and how we could measure food literacy. So we're really relying today and for a lot of Nutrition Connections work on this framework for healthy eating that was developed by our public health partners. And a couple of our members, Elsie and Lindsay, are on the call today if you want to chat more about this. So food literacy is a set of 5 interconnected components. Not just food skills, but food and nutrition knowledge, self-efficacy and confidence, ecological factors such as food systems, the social determinants of health and sociocultural eating practices, and of course, food decisions, which impact dietary behavior. So again, if you would like more information on this description that we're using, you can go to foodliteracy.ca to download the framework. Food literacy is especially important during childhood and adolescence. We know that it increases knowledge and skills, and it also influences food preferences and eating behaviors. But what do we know about eating behaviors in children and youth? We know that children are not consuming enough vegetables and fruit. It looks like from over the past years, water is increasing, which is great news, but milk consumption is going down, which puts some nutrients like calcium and vitamin D at risk. We also see that fruit juice and fruit drinks and soft drinks are decreasing, which is, again, good news. A decrease in vegetable and fruit could lead to marginal intakes of potassium and fiber. So whatever choices children are making is impacting their nutritional status. We're seeing some alarming trends in terms of eating ultra-processed foods. Over 50% of total daily calories are coming from ultra-processed foods, which are high in sodium, sugar, and saturated fats. In fact, it's highest in children ages 9 to 13 years. Again, these stats follow what I've already presented, that we're seeing fewer daily servings of vegetables and fruit and milk and alternatives, less energy from high-calorie beverages, and higher intakes of meat and alternatives. But we still need to have more attention to improve population level intakes of vegetables and fruit, but also whole grains and protein alternatives and lower fat dairy products. So now I'd like to share some of the preliminary data that we have from the study that we've been doing with Ipsos. And we've been looking at eating behaviors in children and families. And the data that we've been collecting is up to the end of December 2019. But we also asked for additional data to see what was happening due to the COVID isolation. So here's some interesting stats in terms of who's eating alone or together. So in December 2019, 53% of families were eating alone. And it went up slightly in March of 2020. Another interesting stat is that sharing a meal together, but having different foods, decreased slightly. So more families were probably eating together and sharing the same kind of food at their meal times. Where are families eating is also an important factor that we've been interested in. And you can see here, and good news is that most 42% or 43% of families are eating at the kitchen table. However, 33% of families are eating in the family room or in front of the TV, and this can lead to distracted eating. Eating at the table slightly increased this in early parts of 2020 compared to a year ago, only about 2 points. So what are families doing while they are eating? 47% are talking or socializing, which is great. We want to see families communicating, sharing a meal together, checking in on the day's events, and having parents being role models. However, we still see that 29% are using screens. And we know that if you're eating in front of the TV or using screens, you're distracted. And we also have reviewed many studies that show that food choices are less healthy when you're using screens. more processed foods, less fruits and vegetables, for example. We haven't provided the data for the other activities, but as we all know, you can be eating doing other activities such as working, reading, in a class, or even on a meeting such as today. Hopefully we'll give you some breaks so that won't have to happen. So also we were interested in seeing where families, how much time families spend on making a meal. And we find that 80% of families spend under 13 minutes, 30 minutes making a meal. And the priority is under 15-minute meals. So people are preparing meals very quickly. In March of 2020, compared to January of 2020, there was a slight increase in meals that took 30 to 45 minutes to prepare. So that's a bit of a context around the COVID situation. So where do families get information? We see that they are using the nutrition label, but 36% are using neither the nutrition label or the ingredient list. The things that parents are looking for on the label include calories, sugar, sodium, and fat. And we are really interested in finding out where parents are getting information about food and nutrition. And we see that online is the highest compared to word of mouth magazines, TVs, and others, the highest by far. So we're really interested in finding out, well, when they are online, which sources of information are they looking at? Are they reliable sources? What kinds of tools and resources are they interested in? So we need to dig a little bit further. We also have Canada's Food Guide on here and other things. And again, this is preliminary data that we're going to be sharing in a report to come out this summer sometime. So now I'm going to hand it over to Jess to talk about what's new in the Guelph Family Health Study.
Thanks, Lynn. Yeah, as we think about trends in eating behavior and meal routines, I think it's really important for us to think about the context and sort of this incredible disruption we've all experienced due to this COVID-19 pandemic. So we explored how these behaviors have changed within the Guelph Family Health Study. And the Guelph Family Health Study is an ongoing longitudinal cohort of families with young children, so with children 18 months to 5 years of age. And what we did to sort of understand what the changes were due to COVID-19 is we sent a survey to 306 families who are participating in the Guelph Family Health Study and gave them an opportunity to respond between April 20th and May 15th. We got the survey back from 254 families, so that's a response rate of 83%. And that translated into 235 mothers, 126 fathers, and 310 children. One of the questions we wanted to know was whether or not their eating had changed since COVID-19. And 70% of mothers, 60% of fathers, and 51% of children stated that their eating had in fact changed since COVID-19. If they said their eating had changed, we wanted to know in what ways. And so we gave them a number of options and they could choose any that applied. This slide here shows you how many reported these various eating behaviors. The green bars are the mothers, the blue bars are fathers, and the yellow bars are for the children. And as you can see, one of the most common changes that they reported was that they were eating more snack foods. About 74% of mothers reported eating more snack foods, 59% of fathers, and 55% of children. And then when we looked, they also reported eating more food in overall. Very few people, or fewer people, certainly reported eating more fruits and vegetables. Interestingly, similar numbers reported eating less. So there wasn't all that much change with regards to eating more fruits and vegetables. Another change we saw, though, was a number of parents and kids reported eating fewer foods from both fast food and takeout. And on our next slide, we took a look at change in meal routines. And nearly 60% of mothers and 50% of fathers told us that their meal routines had changed since COVID-19. And among those, you can see many reported that they were spending more time cooking. They were making more meals from scratch. They were enjoying or sitting down for more meals with their children. And importantly, also involving their children more in food prep. So there's certainly some suggestion that some of the dietary intake may not, changes may have been less healthful, but certainly some that with more time and more time in the homes, there's a change in some of these meal routines, which are things we would certainly recommend. On the next slide, though, I think it's also really important that we think about the context within which families are experiencing COVID-19 and the impact it's having both on their stress, financial security, etc. So we asked some questions on our survey about those things and certainly heard that families are feeling very stressed, that there's many challenges. We also, when we look at financial impact, about 20% of families reported that they are worried that they would not be able to pay their bills on time over the next 6 months. In the open-ended questions where they could just tell us about some of the stressors they're dealing with, some of the key things parents talked about was balancing the multiple roles they have now at home, including homeschooling their children, some of them paid work, as well as parenting role. There was also a lot of discussion about uncertainty, uncertainty regarding the impact of COVID-19 on their own lives, meaning on their own health, the health of people they love, but also a lot of talk about financial uncertainty and concern about the impact that this will have. And this is important, of course, because we know one of the strongest predictors of food insecurity, of course, is financial insecurity. And so I think it's important that as we think about how do we support families over time, these are some of the things we need to be considering as we think about, will these trends continue when families get busier, but also how do we help families to make sure all families have access to food. So now I'm going to pass it off to Eric, who's going to move us forward with some of the facilitation.
Great. Thanks, Jess. Thanks, Lynn. Thanks, Karen. What a great start to the morning so far. Before we get into the speakers and some of the content today, we wanted to just get a sense of the range of people on the line or in the meeting. We've got over 50 people in the meeting, and we just want to get a feel for what is your primary role? So on your screen, you're going to see 9 potential options, and then the 10th is other, because we may not have covered everybody. And so you just click on whichever one you are, and the votes are coming in. And just waiting for about 8 people. Fantastic. Okay, and so I'm just going to end the polling, and I'll just share my screen and show you the results. We've got, we've got over 32% of you are registered dietitians or nutritionists, 23% of you are researchers, 9% of you are policymakers, 7% are educators, 5% are program planners, and 2% are program deliverers or facilitators, and 7% are students, trainees, and then we have 16% are other. So I'll just show you those results. They should be coming up on your screen. So what a great sort of variety of expertise, experience, and wisdom to share for the rest of the day. So we're going to have a couple of speakers now, sort of start to stimulate the conversation, and then we're going to come back to you and do a couple of interactive sessions where we're going to engage you, asking you for your input. So I'm going to hand it over to back to Lynn to introduce the first speaker.
Great. Thanks, Eric, and thank you all for attending today, and as a great variety of people. I see Corinne is online, so you might want to just share your your video for 1 second so we can see who you are. And Corinna's coming all the way from the London, the UK, and she's the director for the Centre of Food Policy at the University of London. And we actually pre-recorded Corinna because we were a bit worried about technology. And so I've actually done my introduction with her presentation. So over to Candace to share the video. And while Candace is getting ready, I just want to let folks know that Corinna will be online, and if you want to put some questions while she's talking in the chat box, she can start to answer those, and then perhaps we'll have some opportunity at the end for some people to ask a couple questions. So over to the presentation now. And Candace needs to put on the sound as well. Policy can support food literacy. Before we start, I'd just like to give you some background on Corinna. She is the director of the Centre for Food Policy at the University of London. This centre is dedicated to advancing thinking and practice of integrative and inclusive food policy through education, research, and outreach. She has worked for the World Health Organization, the International Food Policy Research Institute, the University of Sao Paulo, and the World Cancer Research Fund International, where she was involved in establishing the Nourishing Framework, which is a tool to track healthy eating policies worldwide. In 2018, she was appointed by the Mayor of London as Vice Chair of the London Child Obesity Task Force. She was a member of the Eat Lancet Commission on Healthy Diets from Sustainable Food Systems and the Lancet Commission on Obesity. Corinna is a distinguished fellow at the George Institute for Global Health. So welcome, Corinna, and thank you very much. We're looking very much forward to hearing your presentation today.
Well, thanks very much, and it's great to be here, albeit unfortunately not to be able to be with you in person, but great to be able to participate, and thanks very much for the invitation to be here. So my talk's going to be about how food policy can support food literacy with the goal of encouraging healthy food preferences among children, which is a topic I've been thinking and writing about for quite a while now. But it was a really great opportunity to prepare this presentation and think specifically about this question in the context of food literacy. So I wanted to start with the vision. I always think when we're talking about healthy diets for kids, healthy diets, healthy eating, we need to be thinking about where we want to get to. And it's a very aspirational goal, but it's important to understand what that goal really is. And essentially that goal is a healthy plate. In the Canadian context, a healthy plate. And I know that you've got a wonderful set of guidelines, of food-based dietary guidelines in Canada, which are the envy of other parts of the world. It's a good vision to have. I've put the Lancet plate, which is a plate that was put together by the Lancet Commission, a group of scientists who put together this plate. There were different ways of putting together this plate. None of them are going to be right in every context, but broadly speaking, we know what a healthy diet consists of, and I don't need to repeat that here. What's important about this vision is that it's about that children prefer to eat this diet, and they're eating it, but they also prefer to eat it. And the reason for using that term preference and why it's so important is because when it comes to improving what kids are eating, we want kids to be enjoying and liking, even loving the diets that they're consuming. So of course that's going to involve some treats and some stuff which might not be considered the healthiest thing to eat. That's absolutely fine, of course. But if that dominates the diet, then that becomes problematic. But we want kids to really love eating a healthy diet, and that means that they prefer it, and that introduces a virtuous cycle where kids want to eat a healthy diet. That means they demand it from the food system, and the food system delivers it. That's the aspirational vision, at least, for this. And what we know, however, is children having a preference to have a diet which is broadly speaking healthy is not just a question of saying to kids, you should have a healthy diet. We know that. We're all familiar with that. And nor is it just a question of providing information. Nor is it a question of any one thing, actually. It's a function of a series of fundamental conditions that have to be put into place. And if one of these conditions is not in place, they're going to be undermined by one of the other conditions not being in place. So the first aspect of that condition is that people have to have the necessary knowledge and information about what a good diet is. And that's pretty basic in the world today. Probably it didn't used to be when our diets were just there and culturally conditioned, but now we do need to have that necessary knowledge, information, and education. But it's no good having that knowledge and education if you go out into the world and you can't afford a healthier diet. And instead you can afford a worse diet, an unhealthy diet. Nor is it good having that information and education if you don't have access, convenient access to that healthy diet. But if you've got the knowledge, you've got the information, you've had the education, you can afford it, or it's made affordable and it's accessible in a convenient way. If you have no idea the skills, you don't have the skills, you don't have the literacy to access, buy and prepare a better diet, then none of that is going to be much good. So that skills and literacy is also really important. And the fifth condition is that you actually have the assets. So even if you have the skills, for example, to prepare a better diet, if you're living in a really very poor housing condition without a real kitchen, maybe a couple of stoves, rings at the back somewhere that are difficult to reach, and not proper food storage facilities, it's very difficult to allocate time to do so. If you don't have the time because you're working 2 different jobs and looking after 3 kids, it's pretty challenging. But also if you don't have the psychological capacity, if you don't have the feelings of self-efficacy and confidence, then you're also not going to do it because you think, I'm hopeless at this, I can't do it. And therefore you don't do it. That's the fifth thing. The sixth point is about social support. If you really want to eat well and you've got the ability to do so and all the other things in place, but all your friends, all your family, your partner is just against it, that makes it really tough. And there's a lot in the seventh factor, which is that you need to be prompted around you to buy better diets. If the food environment's around you, if everything around you is again, and it's prompting you to buy the worst things that you shouldn't be eating, it's not going to happen either. So you need to have those healthy food environments around you. So you need to have all of these 7 fundamentals in place. So the vision has to be that plate in the middle, the preference, and those 7 contextual conditions in place. Now, this is about children. But of course, children have caregivers, and the role of those caregivers change throughout a child's life. But at certain points, they're incredibly important. So when we're talking about children and children gaining preferences, we can't just talk about children. We have to talk about their caregivers, parents, and so on, because they play, and the evidence is very, very clear, that what parents eat, what caregivers eat, what they expose their kids to, what they model their kids is also really important. So that's why I consider this about children in the middle, but also very much about their caregivers. And we can see in this picture that food literacy plays a vital role. So I've shaded out in purple the 3 of these contextual conditions, which are fundamentally about incorporate food literacy. Number 1 and number 4 are very, very obvious, but I do think the psychological capacity, the confidence and self-efficacy is also a really important part of literacy as well. So on to the next slide then. The point that I want to make here is that healthy food policies play an absolutely crucial role in enabling healthy food preferences. And an important part of that picture is enabling food literacy, encouraging and enabling food literacy. Now, this is from a paper which is not published in 2020. Sorry, that's a typing error there. It was published in 2015, which I believe is also referenced in a document put together as well by Nutrition Connections in the context of food literacy. What I'm trying to do here is to show the mechanisms through which food policies actually work. And there are 4 mechanisms, and I'm going to talk about 3 of those. And all of those mechanisms work by improving the environments, the systems in which people live their lives. And I've identified 3 here: the social system, the information system, and the food environment, so social information and food environment. And if these environments are healthy environments, they expose people, children and their caregivers, through modelling, through exposure, through the incorporation of new information, in such a way that we know from the evidence that encourages healthy food preferences. The healthy food preferences then produce demand for those healthy social information and food environments. And provided that there is enough income and time held by that family, that can then lead to healthy eating behaviours and good health, which then further leads to greater demand and so on. So you get that virtuous cycle. So let me go through these mechanisms and show how food literacy policies can play such a crucial role in driving those positive environments and driving those healthy food preferences. And the first one is through policies that provide an enabling environment for healthy preference learning. And this is the fundamental. I mean, just imagine if we were to go back to the beginning and say, right, we've got a completely blank slate. And we're going to devise our food policies entirely around ensuring that our babies, infants, children are surrounded by an enabling environment that encourages healthy preference learning. We would be in a completely different place to where we are now, because those kids would grow up in a totally different environment. That would mean that they're exposed to healthy foods in such a way which would help them learn healthy preferences. But we're in the situation we're in now. So the kind of policies that you need to do that is to keep unhealthy food advertising out of the way. And I know you'll be having a talk on that later. So that's part of that seventh contextual factor, the making sure that people are prompted to buy better diets and not the worst diets, getting rid of those negative prompts in that environment. Healthy food standards in schools is also really, really important, because that provides healthy prompts and exposes kids to the healthy food that can enable that preference learning. But you also need to have food literacy policies as part of that package, because you need to have policies that enable children, I'll explain this in a bit more detail later, to be educated and to be exposed to that healthier food. It enables them to train their taste buds up, because palatory education is an important part of our education. We don't value it very much, but it is an important part of our education. Certainly when it comes to inequalities, it's really very important and a part of our inequalities, really. So it's not enough just to have that healthy environment. You've got to put kids in a situation where they're actually encouraged and enabled to be educated about different tastes. And that is also a part of this enabling environment for healthy preference learning. Just say if that child likes to eat healthy food, they're going to like unhealthy stuff too. That's perfectly normal, nothing wrong with that. But that they like the healthy stuff. But they live in a family that is short of time, that is short on income, and which is short of assets. That's going to be hard for that family to enable that child to have a diet that they'd actually like to eat. So that means that part of this picture is also about making sure, and again, particularly from an inequalities perspective, that families have enough income, social safety nets, good welfare systems that make sure that they can actually afford a healthy diet. But you also need to have policies in place which help other gaps which prevent the expression of healthy preferences. And one of those is information. If you go out into a supermarket and say, right, I want to buy healthy food for my family, and there's no information, there's no clear labelling on that food that actually says that a yogurt that looks very healthy on the packaging is actually stuffed full of sugar. You need to have that information on foods, particularly for young children, but for all children. So that means policies require clearing information, such as labelling policies. And if you really want to eat healthy in a family, but you just don't have the skills to be able to do it, and particularly at a very vulnerable stage of life, when you first give birth and have children at that very vulnerable stage, there's lots of conflicting information out there. You're in a mess, it's confusing, you're tired. The easiest thing is to say, I'm just going to take the easy option. So that is a time of life where people really need support to give them that confidence, to give them that psychological capacity, to give them that social support that they need. And there are programs and policies that can do that alas aren't there sufficiently to support people at this current point in time. So that's for people who want to do the healthy thing. And there's also people who just have developed very unhealthy preferences. They want to eat an unhealthy diet, not because they want to be unhealthy, but because they like it. They have a preference for eating unhealthily. Even if they might want to be healthy, they have a preference for the types of foods because that's what they've been accustomed to. And that's a situation. It's not their fault, but that is a situation. And for this particular group, you need to be in a situation where everything in their environment is nudging them in a healthier direction. That encourages them to reassess their existing unhealthy preferences at point of purchase in particular. So they're kinds of policies that require supermarkets and food outlets, food service outlets to nudge people in a healthier direction. But it can also mean that you're having to help people navigate a very complex, very difficult, very unhealthy food environment. So a lot of teenagers, for example, at the younger age spectrum, might not be aware necessarily of the way that marketing is targeting them and the way that they are being nudged towards the unhealthy options. We had a campaign in the UK by Back 2030 recently that was designed to expose that and how a lot of young people don't really understand what they're being exposed to in the marketing. So policies on literacy about what marketing is can also be really helpful in that context. So what I've tried to show here is how putting these policies together can help move people towards healthy preferences, children, young people and their caregivers, in order to help those children. And how that package is required, and how food literacy policy are a part of that package, an important part of that package, those ones in purple. So to summarise, creating a virtuous cycle. Start off with the kids. First of all, you ensure children are in a position of learning healthy preferences, and those policies are in place. If those policies are in place, if children are supported in gaining healthy preferences, then you need another set of policies to ensure that their desire to eat healthily is there. So they have the information, they have the assets, they have the skills, and they have the finances. If children are not supported in learning healthy preferences and that they develop unhealthy preferences, then there are a whole load of policies that can be put in place to nudge them towards their healthy preferences. And this is really important. If you don't remove those barriers and if you don't nudge people, then even if they learn healthy preferences when they're younger, they can always be constantly undermined. So again, you have to have all of these three sort of types of mechanism working at once. So the vision for policies to support food literacy in this context is, and I've taken the food literacy definition and description from Nutrition Connections, that all children have the ability to make decisions about food to support the achievement of their health, and they and those that care for them are able to plan, manage, prepare and eat healthy diets and navigate and engage and participate in a complex food system in order to do so. So what I hope that I've shown in my previous slides is how those policies can achieve exactly that. So now I want to move on to refining this approach even further and talking about identify where and what food literacy policies can be most effective, because what I'm trying to argue is that food literacy policies should be part of a package towards healthy preferences. So how do you actually identify which policies, which food literacy policies will be the most useful and will be the most applicable and therefore the most effective in any particular context? And what I'd like to, the point I'd try to make here is that to do that, we need to take a child-centred approach. And that's the approach that we took in London's Child Obesity Task Force, which is a task force convened by the Mayor of London, a sort of quasi-independent task force housed within the Greater London Authority, which is the pan-London city authority headed by the Mayor of London. And we were tasked with step-changing the obesity response in London. And to do that, what we felt was really, really missing was this child-centred approach. So we started off by trying to understand the reality of children's lives. And in London, of course, we had a very strong inequalities perspective. That's where we were, our starting point were. And then putting together a call to action document, Every Child a Healthy Weight, 10 Ambitions for London, which are available on the website. And as Vice Chair, I had the responsibility of leading the development of these two documents, which is what I'm going to share with you next. The first document, we put together a series of child profiles about the reality of life in London for children. And what we were trying to do this for was it was a communications tool. It proved actually a very effective one. We were really happy with what we achieved with this. But it was also about identifying the types of policies that could be most useful and where there might be gaps in this particular context. And I want to give an example of that. So this is the profile of Justin, and I should say that Justin wasn't called Justin. This was compiled through interviews, through existing work, existing focus groups, as well as new work that pulled together. It was like a composite of different children. And this child lives in very difficult circumstances, in a very poor quality housing situation with no proper kitchen, very difficult life circumstances, very noisy, doesn't sleep properly. We know this is terrible for young children. And there is provision for free nursery care for a certain number of days a week in this country. And it's difficult for the mother to take advantage of that because often, because her son is in a very difficult situation, finds it difficult mixing with other kids, but she does try and take him when she can. And getting to that nursery is quite difficult, and they have to go down the high street, and this is what that high street looks like. It's convenience stores, it's chicken and chip places, and when she goes into a chain supermarket, it's full of half-price offers for unhealthy food. That's basically what it looks like where she lives in London. And very challenging. And so, not surprising, after not eating properly at home and all the challenging circumstances, she buys him a snack from one of these places. It's the convenient thing to do, it's the cheapest thing to do, and under very stressful circumstances with no psychological capacity, that's what's going to happen. And no wonder Justin develops into a fussy eater, in inverted commas. So mum gives up and just gives them the cheap snacks. Gets into nursery where there is a London-wide policy for healthier food in nurseries. It's fantastic, works brilliantly well for some people. But because Justin has never been exposed to these snacks, healthy fruit and vegetable snacks and healthy snacks, isn't familiar with them, isn't exposed to them. So unlike the richer kids in that nursery who eat them and it's great exposure for them, he's like, oh, not really into these. So doesn't eat them. So despite the fact there's a really good policy in place that changes the food environment in that nursery and is there to enable healthy preference learning, he needs some extra work. And what extra work that would need would be food literacy, exposure to taste education, exposure and much more careful work with him and with the other kids as well to taste, to feel. There's a great program in this country called Taste Ed, which does this kind of work, part of the SAPERI field of school of programs which are in place in different countries around the world. So that's an example of where food literacy is really going to make a massive difference, in particular taste education. And it shows that a food environment policy is not enough. You do need to have this kind of policy in place as well. And we use this information to formulate our 10 ambitions for London. And we formulated these 10 ambitions in the words of children. And so, for example, we said our nurses and schools need to give us the best to be the best we can by helping us to be healthy. And that everyone helps us develop healthy habits right from when we're really little. We can hang out with our friends without pressure to buy extra unhealthy food and drink. I don't need to read all of these out. This is about obesity, but very much in the framing of children eating healthier. So if you take one of those, skill up early years professionals, it still slightly makes me wince, this one, because as if early years professionals aren't very skilled. Of course, they're immensely skilled. And we were slightly nervous about saying this, as if implying that they weren't, because they are immensely skilled. But what we discovered in all the background work we did in the preparation of this 10 Ambitions for London is that while they're highly skilled, they simply had absolutely no training at all in how to engage with children to encourage them to develop healthy preferences. This was completely absent in their training. And so that's why we identified that if we want to have these kids to develop healthy preferences, we've already got a programme in place in London that is about healthy food standards in nurseries. That's already there. We don't need to do that. We need to have a situation where the early years professionals have access to training to enable them to teach children in that way. So that's why we identified that as a gap, and that a core training program should be provided. But we also noted that even though there can be healthy food in these nurseries, without people to prepare that food in a healthy way, then often that just because it's got the standards in place, it doesn't work. You need to actually have people who know what they're doing with food in order to turn it into something really nice, which is why we also, because I haven't said this, but I recognise that not all food does taste good. Some of it does taste bad. We can't take that out of the picture. And we need to have food made as delicious as possible, which is why our second recommendation was a food training and qualifications for all early years caterers and chefs. So, final point that I'd like to make is we've done all of this, put all of these policies into place. We've identified the right type of food literacy policy as part of that package in a child-centred way. How do we know it's effective? How do we know it's effective? I want to give an example of this from very recent work that's been done in Chile. Some of you may well be aware that Chile is now the global leader in putting into place food environment policies to help people eat well in the context of their extremely high obesity rates and very high levels of highly praised food consumption. So at the core of this policy was to define, do a nutrient profiling model about what was considered high in fat, sugars and salts and energy. And as part of it, so they did that and then introduced a label onto all the foods that had that definition to say, right, if your product is high in sugar, high in this level, you have to have this black hexagon. So they put that into place. You can see it on Coca-Cola here and Oreo cookies. And the evaluation of that showed that the law, which also applied to advertising and also applied to food in the schools, had a positive outcome. And it was also applied to taxes. There was also, in Chile it was a very small tax, sorry, that wasn't important. The reductions in the purchasing of these foods with the high in labels, or all the foods that were designated as being high in, went down at a rate far higher than had been shown by sugar sweetened beverage taxes in other parts of Latin America. So that was great news, but they weren't able to really say whether it was to do with whether it was the effect of labelling, marketing, or school sales bans, because all of these things came in at once. So it was a great example of doing more than one thing at once. Brilliant example, very positive outcome. But they're not really able to trace cause and effect because of the complexities of evaluation when you do that. But in this next slide, they also did some qualitative work, and they showed that provided insights into specifically what the provision of information on labels to enhance literacy did. And they found that the degree of these warning labels was heterogeneous among participants, but most of them agreed that the children have a positive attitude towards the regulation and have become the drivers of change in their families. So actually these labels, children got really into these labels. And this is one of the citations. My son likes cookies and nuts, so I tell him, choose the cookies with the fewest labels. And then he can see for himself, he can become literate in what kind of foods cookies are healthier. And he has a bit of fun going around the supermarket, being much more literate than he was before and choosing the healthiest cookie. But what happened is that in the lower socioeconomic status group, some mothers were so concerned about their kids eating enough that they were a little bit more skeptical about this, and they were kind of not so keen on this compared to some of the middle and higher income families. But because their children were committed to it, that's why they started to become kind of swung around towards this. So you can see what the conclusion was in that regard from this second citation from the text of the study. So that is an indicator that if we're really going to understand the impact of this study, of these, we need to have a combination of both quantitative and qualitative work, so we can show, broadly speaking, it seems to be working, and then insights into the why. And in this case, it really does support the fact that these kinds of labels can support literacy and engagement among children and young people. So, to conclude, key points. Creating a virtuous circle of healthy preference for children takes a packages of healthy food policies, different types of food literacy policy, in other words, food literacy policies that build on reflect the different elements of food literacy. They all have a vital role to play as part of that package. Identifying those where the food literacy policies and interventions, where they're needed and how they can be most effective, requires a child-centred approach, so it's clear where they need to fit into that part of that package. Evaluating the impact of those policies is always going to be challenging and requires quantitative and qualitative methods. I will end there. Thank you very much.
Hey.
Thank you very much.
That was an excellent presentation and a great review of the variety of policy levers that are possibilities to impact the food preferences of children. So that was very good overview of what we could do here in Canada with regards to our children and policies impacting food literacy. So we're going to just take a pause and give people a chance to provide some questions in the chat box, and then we'll proceed with the Q&A in that, starting with some of the questions there. Okay, thank you.
Great.
Great. Thank you. So Corinna, you could take yourself off mute, and I see that we have a number of comments already in the chat box, but I did have a handout from Bill Jeffries. So perhaps, Bill, you would like to unmute yourself and show your screen if you like to ask your question.
Yeah. Hi, Karina. I have a couple of comments that I'm interested in your response, particularly the second one. First of all, I mean, I see a lot of these logic models about what impacts food choices, and I don't know if anybody does path analysis anymore, but it'd be interesting for me to see whether the data kind of support these and what the relative contributions of the various hypothesized contributors are. But when I looked at your list of 7 as a separate matter, I looked at your list of 7 factors that influence, I guess, dietary practices, and compared them to the 4 P's of marketing. You know, the price, product, promotion, and place. They were roughly in accord with that, although the promotion thing, I think, was involved with several of your factors. The one missing thing was product. And if you look at what I think is generally regarded as the key deficiencies with the diet, not enough whole grains, too much sugar and salt, those have a lot to do with the composition of the product, and whether, you know, it's a good idea for there to be 100 types of white bread on the market and white and refined grain pasta, and only a handful of whole grains. And, you know, it goes to this whole point about, particularly in the United Kingdom, reducing sodium in the food supply and reducing sugar in the food supply by pressuring companies to change those. And that doesn't come up at all in your discussion of food literacy, which I guess indicates to me for the first time that's so much more of a focus on the, I guess, the deficiencies of the consumer rather than the product and the actions of the producer.
Yes, thanks for that comment, Bill. Nice to hear you after all of this time. It's been a while. I would argue that I've put the product in every single one of those 1 to 7, as well as in the middle, because what we're talking about is the product that people eat. So all of them. So, for example, gathers a lot together, as I pointed out, about promotion and placements. It is to buy what I say there is a better diet or a healthy diet. So implicit in that is that diet needs to be available, and the foods need to have those qualities. And of course, in the middle, there is the diet which is made up of these foods, which doesn't involve much refined white flour. So I think you make a good point, but what I've tried to do is sort of embed that throughout the whole image.
Great, thank you. I just want to refer people to the chat box. We're not going to have time for a lot of questions right now, but there's been a lot of discussion about whether we should be focusing in on the school environment or the early childhood setting. You really focused in on the child-centered approach. And then there's this dichotomy between whether we should be focused in on actual dietary behavior, but I think your argument is more around the developing the dietary preference of children at an early age through taste education. So perhaps just a few comments on that.
Schools are absolutely vital. The point that I made about early education and early years is not to suggest that we then forget about primary age children or elementary school age children or even older or even adolescents. It is simply to point out that the early years between the ages of 2 and 5 have tended to be not given enough attention, and I'm saying that I can't speak for Canada, but from a global perspective, from this perspective, that you tend to get things that start when kids go to school at 5, and then you get stuff around when they're much younger, but this age between 2 and 5 tends to get ignored. But also the amount that the importance of this issue as a basic part of our society. It's considered okay, often women, but parents, you've got your baby now, go and feed it. We'll give you some information leaflets. Again, I can't speak to how it is in Canada, but I'm giving a global perspective. It's your responsibility. Of course, it has there's that level of responsibility in the family, but it's a societal responsibility to support families. And that in the early years, it's hard, it's difficult. And that's what we're not doing in any of these sufficiently, whereas there is quite a big conversation about schools.
Great. And I think the other comment I heard was around the parents responding to, I don't know what's happening, I'm echoing. Just your example from chilly with the parents responding that their children were actually taking more control over making their own food choices. And so perhaps educating the children around the strategies is an effective approach to reach the children. However, recognizing the parents, however, recognizing they have a lot of challenges at home, whether the parents may not have the ability to purchase the healthy foods or some of those other barriers you mentioned. So again, just commenting on the child-centered approach, reaching the parents.
Yeah, and I think there is anecdotal evidence for this, and I'm sure some people on this webinar will have encountered this about children influencing their parents, but it isn't something which strategically is thought about very much in policy. And I was using that example to show the value of qualitative evidence in actually showing the mechanisms through which these things can actually operate. And the reason that that's important is because of the focus on inequalities, which is very important, certainly in my current area of work. That owing to, for very good reasons, that there might be greater challenges from an equality perspective, but actually looking to children to lead the way is a different starting point. Again, that we should be thinking about, and you only can really get to that if you take this child-centered approach and start to think about it from the perspective of the child and actually engage with children in these issues.
Great. And I think one last question, I think Russell has posed a question around the equitable access to healthy food. So we know that not all families have access to healthy food. So that is a challenge. How can we overcome that? Either through a nursery or childcare programs or school programs, but it is a reality, and you pointed that out during your presentation, that not all families have the same access to healthy foods.
That's correct. And I think we need to be quite careful in thinking through the access issues. At the risk of making myself very unpopular, I think we need to think about access issues in the broader context of access. So the work that we do in the UK, for example, which is is in-depth interviews with parents and go-along interviews with parents, we find that those who have a lot of convenient access to healthy food and those who have less convenient access are still behave in the same ways, and those practices are issues around the complexity of their lives, working 3 jobs, trying to look after kids, as well as poor quality housing, concerns about affordability, meaning that even though fruits and vegetables might be affordable, in some senses are less affordable compared to a 12p pack of cookies. So in other words, access issues, I think, have to be contextualized within all of the other aspects of people's lives. And just actually physical access or even economic access may not be the primary thing. It is one of a part of a package of those 7 things that matter. And if we only focus on saying access is the problem, let's put a store in here or let's put a voucher in here, we won't be targeting some of the other issues which are also really important in people's lives. So it's about putting it together into that package, and that's what I tried to do in those seven areas.
Great. Well, thank you so much, Dr. Hawkes. I think we're going to have an opportunity to discuss some of your ideas regarding the child-centered approach, early childhood education, health equity issues in our breakout session this afternoon. So I'm going to take a pause now because we promised everyone a bit of a break right now for about 10 minutes. So if you'd like to continue to stay on and chat in the chat box, you're welcome to do that. For others who need a little bit of a break, we're going to take a 10-minute break and come back at 25 after 11. So I hope that works out for everyone. And again, thank you so much, Corinna. We do have your recording. We're hoping to be able to share that at some point in the future. But that was an excellent presentation, and we really appreciate you taking the time out of your day to speak with us.
Sure. Thank you very much, everyone. Thank you.
Thank you.